Welcome to this week's edition of Weekly Digest, your front row seat to the policies, programs, and people shaping Guyana's development journey. Each week, we go beyond the headlines to follow ministers of government as they implement the administration's agenda one step, one story, and one community at a time. This week, Prime Minister Brigadier Retired Mark Phillips took center stage at the launch of Ollie the Otter's River Adventures, a new children's storybook designed to inspire environmental awareness and biodiversity conservation among Guyana's youth. During his remarks, the Prime Minister emphasized the transformative power of storytelling in environmental education, describing it as one of the most powerful tools in education. But the week did not stop there. On Friday, Prime Minister Phillips launched Guyana's first internet exchange point, a milestone for digital connectivity. He described this as a significant achievement in Guyana's journey towards a more connected and digitally inclusive society. The Prime Minister noted that while more than 1,500 IXPs are active globally, fewer than 120 are located in Latin America and the Caribbean. Guyana is now proudly among them. Minister of Public Works Bishop Juan Edgel visited the 1 Mile Nursery and Primary Schools in Linden, Region 10, to oversee the distribution of the Because We Care cash grants. There, he reinforced the government's unwavering commitment to education and financial support for families.
Our intervention of lending support to parents to ensure the educating and adequate opportunities to education of our children was not because of an oil bonanza. It was because of policy direction and the belief of a government that paying attention to our children and ensuring that every one of our children have an opportunity to receive the best was available.
Guyana is gearing up for the 10th National Cleanup Exercise on Saturday, June 7, 2025, a nationwide effort to build a cleaner, greener country. Spearheaded by the National Enhancement Committee, the exercise will tackle the removal of garbage, derelict vehicles, and scrap metal from communities nationwide. In Georgetown, the effort will also focus on upgrading roads to improve safety and urban aesthetics. Minister within the Ministry of Public Works and Chair of the National Enhancement Committee, Deodat Indar, led a high-level planning session on Friday to coordinate mobilization and operational strategies. The Board of Industrial Training, BIT, celebrated its 115th anniversary with a Tri-Skill exhibition and fair on Tuesday at the Arthur Chung Conference Center, Liliendal. Minister of Labour Joseph Hamilton delivered the feature address, highlighting the growing demand for skilled labour in Guyana's expanding economy. He stressed the need to elevate technical and vocational education and training to the same prominence as academic education. The Ministry of Health officially launched the One Guyana Health Project at the Aden Hotel in Georgetown. This initiative aims to strengthen Guyana's resilience to health emergencies by recognizing the interconnectedness of human, animal, and environmental health. In the remote mining communities of El Paso and Mycobee, gratitude is shining brighter than gold. Families there are welcoming the Because We Care cash grant. It is a lifeline in these hard-to-reach areas. Leading the effort is Minister of Amerindian Affairs Pauline Sugay, who urged parents to keep investing in their children's education.
We have placed as a government priority spending and allocation on education. It is one of the biggest portion of our budget. It is looking at ensuring that we upgrade the facilities, the school environments, that we replenish textbooks, that we also provide furniture, that we do training for teachers, etc.
The Ministry of Education hosted members of the Duke of Edinburgh's Caribbean Canada Leaders Dialogue, fostering cross-border leadership and cooperation on sustainable development and innovation. Minister of Human Services and Social Security Dr. Vinder Prasad attended the United Nations Population Fund's Trainer of Trainers workshop focusing on protection from sexual exploitation, abuse, and harassment in the workplace. Later in the week, Dr. Prasad met with residents of the Hindu Society Mandir in Cummins Lodge, addressing concerns from old age pension to childcare and domestic violence. This brings us to the end of this week's edition of the Weekly Digest. For more stories and updates on government initiatives, visit dpi.gov.gy or follow us across our social media platforms. Thank you for joining us, and remember, together, we're building a stronger Guyana.
Top 10 for the high suicide rate in the world.
We have implemented a decriminalization of suicide. A lot of countries that were once British colonies still maintain these laws.
I decide to commit suicide. I take the poison bottle and drink it.
There shouldn't be any stigma because mental health issues is just like any other issue that you might have, any other problem. It's like diabetes, it's like high blood pressure.
If positive change is needed, political will is necessary.
All right? How are you doing?
Our mental health laws were quite outdated. In fact, going back to 1934, colonial laws were not fit for purpose. The terms that were used were very obsolete. Terms in the law that speaks to people being an idiot, terms that would be derogatory in a modern society. The principles that were encapsulated in that law is not fit for modern healthcare.
I want to commend all my colleagues for speaking on this matter. This is something that we have been talking about for many years now. And finally, we were able to bring it to this assembly and to pass it. Thank you very much.
2022, two landmark legislations were launched, the Suicide Prevention Act and the Mental Health Protection and Promotion Act, a different law that deals with working or having mental health services and treatment in a more human rights-based approach. For many years, there was only two places Guyanese could have gotten those services. The Georgetown Public Hospital Psychiatry Department was one, where persons who need an acute care would go there. If long-term care was needed, persons would be sent to the New Amsterdam Psychiatric Hospital, which, for all intents and purposes, was Guyana's asylum.
If somebody was deemed to be insane, you lock them away and that's it. It was felt that they were a menace to society.
This stigma is very much alive in the community. People don't want to come to the hospital, even though they know they need the help.
Helping to break that stigma in order for persons to get help. Because of trust issues and past experiences, a lot of persons don't want to open up. They will just simply say, by the time I get home or by the time I leave somebody's house, my entire family knows, the entire street knows. So helping to break that barrier when it comes to the stigma, that would be a stepping stone for us. When person, they're not feeling that well mentally or they speak about it, they're perceived to be mad or they're perceived to have evil spirit on them, that spiritually something is wrong with them.
There is a very big stigma, and this is one of the reasons why we want to go away from having a mental health facility or a psychiatric hospital. For people to access mental health care, they have to come to the psychiatric hospital. We tend to patients from all 10 administrative regions of Guyana, from Essequibo to Linden to Georgetown.
Modern thinking, however, is that persons should not be institutionalized. When a person has an acute episode, they would come to the hospital, they would be treated, hospitalized like with any other condition, and then you're discharged and you have follow-up care at a different level. Right now, we are in a phase of developing new infrastructure. We have under construction 8 new hospitals. We also would start another set of hospitals in another month or so. This would include Maruka, Keto, Camarang, and Letem. These new hospitals provide specialized care, which for a long time only happened on the coast of Guyana.
You have a mental health issue, you get help in the very same regional hospital. I was sent here by the Ministry of Health. We are moving our mental health service from a central level to the communities. 2 years ago, when I started working here, I met a total of 215 patients. With the help of the ministry and the Georgetown Hospital Psychiatry Department, we worked to decrease that number of patients. You want to go home? We make sure that we get to the bottom of what their diagnosis is. We found their family history. Why are they here and those kinds of things. This patient, Medasi, he has been here for quite a number of years. He is very stable, right? He had his diagnosis. What we're trying to do is to get contact with other family members so he can go back into society, move back into his hometown and live. He helped the patients out, right? He's a nice guy. We chose the persons who we found that had a social support, that can get access to mental health services wherever they're going. We made contact with the family, we made contact with the community, we made contact with the hospital where they're going, and we try to reintegrate that person back into the society. We're going to see the patients who are here for like many years. They're ready to go home, but because we don't have any family member for them, they're living here. You're going to you want to go to Georgetown? What we should have is mental health services being offered in all 10 regions of Guyana so that people can access quality mental health care without having to be institutionalized. This is the acute ward. The patients that would just come in for like drug abuse and domestic violence, court would send them to the hospital. Prior to the new mental health legislation, we had a problem where the court would send patients and would have to keep them here for probably 6 months to 8 months, sometimes a year. But with the new legislation, we don't have that problem. What we want is for people to be in the community, access quality mental health care, and at the same time, live with their family in a dignified manner, just like everyone else, and not being sent away to, in the layman term, a madhouse because you have a mental health problem.
We're very grateful for having laws that are user-friendly, laws that speak to the benefits of patients. Patients now have rights. Our prior mental health ordinance dates back to 1930. Suicide attempts were considered criminal.
A lot of countries that were once British colonies that still maintain these laws. If somebody attempted suicide, you're not going to get people reporting it. And if you don't report, then you can't solve the underlying problem. So they don't need to be in jail. They need help.
A national suicide prevention helpline is going to be launched before the end of the year. It's going to be 24 hours helpline, which we will provide with counseling services. Now, this is something that has never been done in this country before.
Hi, good afternoon. IDRF Guyana. How may I help you?
Something that is going to revolutionize the way things are done dealing with suicide attempts.
I work in a new department established at the Office of the President. It's called the President's Special Initiatives for Health, and we work primarily right now on mental health projects. Our Project Office is spearheading a national mental health website where anyone can just log onto the website, access information, general mental health awareness.
Since the implementation of this law, that there has been a significant drop in the cases of suicide. We have almost halved it.
There will be a 24-hour chat service where anyone can log onto this website and talk to someone if they're experiencing crisis, if they just feel down or depressed and they just want someone to talk to. We're hoping to have that launched in tandem with World Suicide Prevention Day. If someone is in need of further counseling or they need to schedule an appointment with a professional, all of that can actually be done through the chat response agent on the website.
Me and my husband had a little problem, and then my sister-in-law, she came in and she started to beat me up. She take my phone. She said that I'm fair with a man. Then I go back my mother there, and with the drinking speed, I go and I take the poison and I drink it.
70% or more of the suicides that occur are done by pesticide ingestion. They primarily occur in East Indian communities. It could be because these are the persons that actually have easy access to the pesticides, the people who live in farming communities.
I was in the hospital for 2-3 days. The police came and they take statements, and when I got discharged, I go back by my mother them. And my husband come and he asked me pardon, and after that, we live back happily. I have 2 kids and they're small, and I will never do it again. I would like to have a counselor with me and my husband.
In Guyana, we're dealing with a mental health project. That project is currently now being executed. The project is tailored in such a way to tackle suicides.
Me and my husband must normally get problem. One day I decide to commit suicide, where I take the poison back and drink it. And then I land in the hospital. When I came out, come and give me advice not to drink poison, stay away from suicide. I'm feeling quite all right since I seek advice from people.
We had national suicide prevention training, which would have trained a total of 760 persons.
I urge young people like me who have problem at home to stay away from suicide.
What we have been doing is taking mental health care delivery to the communities. We have been creating beds in general hospitals to treat people with mental health needs. And so they don't have to be transferred from their communities to a central location in Georgetown or New Amsterdam. So tremendous changes. We have clinics in all the regions of Guyana, except Region 8, but we practice telemedicine. All the regions, they have access to our on-call roster, meaning a team being available to people with mental health needs across Guyana on a daily basis. Many times, a team of persons will bring in somebody who is physically restrained because that person was creating havoc in the village.
I am Mr. Sean Spencer. I work here at the Johnson Hospital at the psychiatry department. What basically we do here, make sure there are no sharp objects or tools or knife, whatever, anything that it can harm the self.
They can be very threatening to all those who are around them.
Working along with the doctors and the nurses, helping them also to apply the medicine and the injection, whatever they needed assistance.
It can get really ugly, but that's not what we meet every day. We have outpatient clinics, and our doctors go there once or twice or more than twice a month. On the East Bank, we have been able to put a psychiatrist who takes care of that corridor in the Department of Psychiatry. We see an average of about 500 persons per week as outpatients, and as inpatients, we will have on a daily basis between 8 and 18 inpatients. It's just like any other part of the world where you have anxiety, depression, substance use, chronic diseases, the psychotic type like schizophrenia.
In this very compound is where the new Berbice Hospital is going to be built. The plan is to have a wing for psychiatry and mental health into that hospital. In that service, we would offer all the service being offered here, but in a general hospital setting.
My name is Councillor Stephen Jacobs. I'm here standing on Border Street between Robb and Regent. And what you're seeing here behind me is garbage. It's filth. And over the years, the National Enhancement Committee, through a government program and initiative, has been very active in bringing awareness to proper garbage disposal. And this coming Sunday, it'll be yet again another exercise where people from churches, people from the mosque, people from the masjid, caring citizens are expected to come out and show their appreciation for a clean environment. And we're urging everyone to come out. Not just that alone. It's important that we understand who has the responsibility to keep this city clean, and it is the mayor and city council. But the government, through their program, will continue to assist this and bring some sort of alleviation to our citizens. I hope to see you this Sunday so we can get rid of these. I hope to see you. Please play a part and participate. Thank you.
My name is Alfonso de Armas, and I'm a city councillor for the city of Georgetown. This afternoon, I'm standing on Smythe Street, where, as you can see behind me, there's quite a large buildup of garbage. Now, this is meant to be the role and the duty of the city council to keep the city clean. Unfortunately, they have failed time after time, year after year. And so, once again, the central government has had to step in and do the job that the city council was meant to do. And so, this Sunday, June 8th, there is going to be a massive national cleanup exercise. And so I'm imploring all of us who are civic-minded, who care about our country, come out and play your part in this massive national cleanup exercise.
I'm Cathy Smith. I'm the president of the Georgetown Chamber of Commerce and Industry and the vice chair of the Private Sector Commission. A clean environment is not only about aesthetic, it's about health, it's about safety, it's about pride of community. As businesses, we have a pivotal role in setting the standard. Clean premises doesn't mean only protection for your employees or for your customer. It's about displaying a good image for your country. What I know about Guyanese is that we have a deep love for community and for country. And if you look behind me, that love is not being reflective right now. This is a place where Guyanese come to relax and to reflect. And this is not what we want to see when we come here to relax and reflect. So what I want to encourage Guyanese, especially the business community, to do, on Sunday, June 8th, come out in support of the effort which is being pushed by His Excellency and other agencies in Guyana, as we unite as one people to clean our city. So together we can create a cleaner, greener Guyana.
Welcome to this week's edition of Weekly Digest, your front row seat to the policies, programs, and people shaping Guyana's development journey. Each week, we go beyond the headlines to follow ministers of government as they implement the administration's agenda one step, one story, and one community at a time. This past Sunday, Prime Minister Brigadier Retired Mark Phillips delivered a heartfelt message to the nation at the Environmental Protection Agency's annual World Environment Day Green Walk and Exhibition 2025. Speaking under this year's theme, Ending Plastic Pollution, the Prime Minister urged Guyanese to take action not just for today, but for future generations. Also this week, the Prime Minister visited Caneville on the east bank of Demerara, where he spent time listening to the residents. From calls for better roads to expanded youth training programs, he took note of their concerns, promising that their voices would not go unheard. Community voices also took center stage on Tuesday when Minister of Public Works Bishop Juan Edgel met with residents of Northeast La Penitence. They're hoping to turn an underused area into a much-needed recreational space. Minister Edgel assured them that work will begin soon. A contractor has already been identified and a special projects unit will take it from there. The following day, Minister Edgel was up early inspecting ongoing works along Aubrey Barker Road. He urged contractors to speed things up and reminded everyone that timelines matter. Upgrades to internal roads and drainage are also planned for North and South Rumveld. As the country prepares for the national cleanup exercise on Sunday, Minister within the Ministry of Public Works, Deodat Indar, met with representatives from the Private Sector Commission to rally support. He encouraged businesses to show up, pitch in, and help keep Guyana clean together. In Blackbush Polder, more than 250 families got a virtual preview of their future homes at the Hawkstye housing development. Minister within the Ministry of Housing and Water, Susan Rodriguez, shared updates highlighting that over $902 million has been set aside for infrastructure in the first phase. And in the Block B Experiment Housing Scheme, allottees finally set foot on the land they'll soon call home. Housing and Water Minister Colin Kroll was there to personally walk them through the plans, assuring them that smart strategic development is already underway. Minister of Agriculture Zulfikar Mustafa started this week in the farming community of St. Lawrence behind Parika. He met with residents and discussed ways to unlock the area's agricultural potential. Then on Wednesday, the minister was on the Quarantine Coast engaging with farmers in the Brackish Water Project. He listened and committed to finding real solutions. Health Minister Dr. Frank Anthony, meanwhile, spent the early part of the week at the opening of the European Union's Health Investment Mission. He reminded participants of the urgency to build a more resilient health system, especially after the lessons of COVID-19. The event brought together 10 leading companies looking to partner with Guyana to boost regional pharmaceutical capacity. Later in the week, Minister Anthony met with several private healthcare providers. One highlight, the introduction of the iStat Point of Care system, a portable tool with potential to improve frontline medical services. And on Friday, Minister Anthony celebrated a different kind of achievement. He delivered the feature address to 11 graduates of the Vocational Skills Training Program at the Open Door Center run by the Ministry's Disability and Rehabilitation Services. He praised the staff and students for their dedication and for showing that with support and opportunity, no door is ever truly closed. From fighting plastic pollution to planning new homes, from strengthening healthcare to building better roads, it's been a week of action, connection, and commitment. That's it for this edition of Weekly Digest. We'll see you next week with more stories from the heart of government.
My name is Alfonso de Armas and I'm a city councillor for the city of Georgetown. This afternoon, I'm standing on Smythe Street, where, as you can see behind me, there's quite a large buildup of garbage. Now, this is meant to be the role and the duty of the city council to keep the city clean. Unfortunately, they have failed time after time, year after year. And so, once again, the central government has had to step in and do the job that the city council was meant to do. And so, this Sunday, June 8th, there is going to be a massive national cleanup exercise. And so I'm imploring all of us who are civic-minded, who care about our country, come out and play your part in this massive national cleanup exercise.